On behalf of the American Heart Association and No Diabetes by Heart, I would like to welcome you to today's webinar, Get with the Guidelines, Coronary Artery Disease, Updates to Data Collection and Measures for Diabetes Care. My name is Renee Sednew, and I'm a Program Development Manager for Quality Outcomes Research and Analytics at the American Heart Association. I'm joined by my AHA Quality Outcomes Research and Analytics colleagues, Liz Olson and Jeannie Rash. Before we begin, I'd like to quickly review how to use this webinar platform for today's event. If you'd like a copy of today's presentation, you can download a PDF in the Handouts section of your attendee control panel. If you experience technical difficulties, most user issues can be resolved by refreshing your browser. If that does not work, please contact the GoToWebinar customer service team found in your confirmation and reminder email. At the conclusion of today's presentation, you will receive a link to access the recording as well as an invitation to complete our feedback survey. You will have the opportunity to submit text questions to today's presenters in the questions section. You may send in your questions at any time and we'll review them during our Q&A at the end of the presentation as time permits. Cardiovascular disease is the leading cause of death and a major cause of heart attacks, strokes, and disability for people living with type 2 diabetes. The American Heart Association and the American Diabetes Association, along with industry leaders, have proudly launched the groundbreaking collaborative initiative, No Diabetes by Heart, to reduce cardiovascular deaths, heart attacks, and strokes in people living with type 2 diabetes. The No Diabetes by Heart initiative supports quality improvement efforts by engaging directly with hospitals and outpatient clinics to provide long-term support to their teams of professionals as they redesign healthcare to better serve patients with diabetes and cardiovascular disease.
AHA's Target Type 2 Diabetes is a component of the broader initiative that aims to ensure patients with type 2 diabetes receive the most up-to-date evidence-based care. To bring attention to this critical high-risk population, the American Heart Association has established Target Type 2 Diabetes Honor Roll Recognition, an opportunity for hospitals to participate in Get with the Guidelines Heart Failure and Get with the Guidelines Stroke. Hospitals with these modules have access to diabetes-related registry elements and reports. Hospitals that meet specific measure thresholds based on these elements may be eligible for recognition in the Target Type 2 Diabetes Honor Roll alongside their existing Get with the Guidelines awards. This past year, we gave out more than 1,400 Target Type 2 Diabetes Honor Roll awards. Award-winning hospitals received national recognition in several locations shown on this slide, and we extend our congratulations to all of them. We wanted to walk you through in this slide the roadmap for the development of coronary artery disease diabetes measures. When we release our measures this December on the 11th, you'll have access to data elements and reports within the coronary artery disease module. We will also provide you with an extended webinar in January that goes into the science focused around this update and its relationship to diabetes. Our process for exploring data through these new measures will mirror the same recognition development process that was used in our heart failure and stroke modules. And so we wanted to share with you a little bit here behind the scenes of how this process works. We'll begin to collect the data in the IQVIA registry platform, the IRP, where you enter your data. We'll be reviewing that data with our quality improvement team and our national clinical volunteers to analyze, review, and assess the data that's been collected and determine from that point what any appropriate baselines would be if we were to add these in to any measure recognition in the future. I want to emphasize strongly that the data that's and measures that are being updated in December this year do not impact your 2022 awards. based on the 2021 calendar year data. And if any changes are going to be made to CAD recognition, it would not be before 2023. And we would provide additional information and guidance and webinars so that all hospitals are prepared for any potential changes. At this time, I'm going to turn the presentation over to Jeannie. We'll share here the save the date. We encourage you to register for the webinar. It's on January 26th. We'll share that out as well. And we will be going through with Dr. Tracy Wang the link between diabetes and coronary artery disease, sharing more of the science link between these two and our update. Jeannie, I'll turn it over to you.
Hi, Jeannie, I think you might be on mute.
You're right about that. I apologize. Good afternoon, everyone. I'm Jeannie Rash. I'm one of the managers for the Get with the Guidelines CAD registry. Today, I'll be reviewing with you the updates to the online data collection form for Get with the Guidelines CAD. These updates that I'll be showing you will become effective starting sometime on Saturday, December 11th. As you're probably familiar with our other updates, the updates usually begin at midnight on Saturday and should be completed later that day. Next slide, please. So what will happen after the update is made on the 11th? The changes that I'm about to review with you will be applicable to all patient records that are created on or after December 11th. And a key indicator for you to know that the diabetes fields will be included in the data collection. At the top of the form, there's a field for the date that the record was created and the element groups for the form, and you'll see diabetes fields to indicate that these new elements are now part of the data collection. There's just a few updates that you'll see on the form. The first one, or the first two, are on the pre-hospital arrival tab. And these include new options for recording the type of diabetes. So there's type 1 and type 2, or if the information is not available, an option for not documented. So just the new options are what's being added, and not specific to the diabetes updates, but this field, patient medical history, will no longer appear as a drop-down list. We'll have the full list in two different columns on the form. So I think everyone will be pleased to see that change as well. Also on this tab, we have a new element. It's the new diagnosis during this admission to indicate if the diabetes was newly diagnosed. There was no previous medical history, but newly diagnosed. And the options here are yes and no. Next slide shows the update to the discharge medication. And there's 4 potential new data elements in this section of the data collection form. The first one is asking if antihyperglycemic medication was prescribed at discharge. We have the usual options of yes or no or NC for contraindicated. Whenever the abstractor would select yes, they'll be prompted to select the class of the antihyperglycemic medication. And there are 9 different classes to choose from the drop-down list. And then for each class, there's a selection for the medication name. And the medication selections are based on the class that's chosen. This screen here is illustrating that there are 4 options for the medications in this section. You'll recall that our new platform registry uses a show hide feature that will only show the elements that are relevant. So if only one class is selected, there'll only be one field for a medication. And then also on this section is a question at the bottom there asking, was there a documented reason for not prescribing a medication with proven cardiovascular disease benefit? This question is only relevant and will only appear if an SGLT2 inhibitor class was not selected. Otherwise, it would be hidden. It wouldn't appear on the screen. So for the SGLT2 classes, there are 4 different medications of this class, and they'll appear in the drop-down list once you have the online form available. And those 4 drugs include Farxiga, Jardiance, Steglator, and Invokin are the drugs. So if the patient, those are the drugs that are considered to have proven CVD benefit. On the next slide, you'll see what the measures are that are being added. Liz reviewed that we're adding these measures, and these are available to all the users under the operational reports and the header for Get with the Guidelines-CAD measures report. There are 3 categories for measures, or we sometimes refer to those as bundles. The first one is the diabetes measures AMI patients. So you should know that these measures include all AMI patients, both the STEMI and the NSTEMI patient. And the measure titles should look familiar to you. All of these are currently included in the Get with the Guidelines-CAD registry. We've just adapted them slightly to include all AMI patients and patients with diabetes. So there are 7 measures that then comprise the composite measure that's available. And again, as a reminder, composites measure is just a combination, taking a look at all the scores of these 7 measures and providing one single score. At the bottom, there's the category for the diabetes reporting measure. There's a single measure in this category, and this is a measure to determine if antihyperglycemic medication with a proven CVD benefit was administered to the patient. This measure is considered reporting, which will not be included in any composite at this point. So these measures will be available to everyone starting on December 11th. Again, they won't really be applicable for any discharges or any records created on or before December 11th. So over time, once you start collecting the information, each hospital will be able to generate the performance for each measure and track the performance over time. And this is what we'll be doing over the next year or so, taking a look, see how hospitals are performing. The idea is to give everyone an opportunity to work out your workflows and enhance the performance for each of the measures. So I do want to also show you just briefly on the next slide the patient populations for these new measures. As I mentioned, the measures should look very familiar to you. You know, the measures like ACE-ARB, prescribed at discharge. However, for the measures in this category, because they will include all AMI patients, we'll look at those that are specified as STEMI or STEMI equivalent. And if they're not a STEMI, we'll capture those by records with a documented positive cardio biomarkers in the first 24 hours. So that will be the initial patient population. And then we'll be including patients with either a medical history of diabetes or diabetes that was newly prescribed during this admission. So this is the patient population for those 7 measures in the composite, and it does differ slightly for that reporting measure for the antihyperglycemic medication. And on the next screen, you'll see how the population differs slightly. We'll continue to include both STEMI and NSTEMI, but this measure is specific to patients only with type 2 diabetes. And remember, that was specified as an option in the patient medical history. Okay, that concludes the update specific to the diabetes. I would like to make sure everyone understands there on the December 11th, there will be some additional updates made to the data collection form. Nothing too extensive, but I can review those for you briefly here. We are adding some new options for ECG findings that show STEMI or STEMI equivalent, just to add more specificity. So abstractors will be asked to identify if the finding was specific to an ST elevation, posterior MI, or left bundle branch block. And then if the ECG findings were not STEMI, there are already a few options on the form. We're just adding a few additional, again, for the purpose of capturing some additional specificity. We're adding on the hospitalization form under the risk stratification scores a field to enter a heart score. There is the capability of indicating that the heart score was done, but we've added a second field to enter the actual score. We're modifying the statin at discharge element to align with all the other discharge medications, adding an NC option for that. And then for those of you that are from referring hospitals, you'll be familiar with our referring hospital form. That's a much shorter form for those patients who get transferred out. We are adding a few additional elements to that form. This is based on customer feedback. We're adding things like the troponin values and things to that form. So you can expect to receive additional information about all the updates occurring in Get With The Guidelines-CAD next week. You'll get the typical written release notes, and we'll also be reviewing some of these updates in that January webinar that Liz just mentioned. So just everyone look out for the email with the release notes. You'll have those in writing. And as always, contact your local quality improvement manager if you have any questions. So looking forward to updating the Get With The Guideline registry again.
Thank you, Jeannie, for those very helpful updates and screenshots. We will now move into the audience Q&A portion of today's program. As a reminder, you can still enter questions into the questions pane of your control panel. So I'll just go ahead and get started. There are a few questions about third-party vendors. So Jeannie, probably a question for you. When will third-party vendors have access to these updates, to the details of the updates?
They've already been provided with the information for the updates, all the specifications. We routinely provide them with all our specifications well in advance of the update. However, you'll want to check with each individual vendor to determine their timing.
Great, thank you. And there's a question about the presentation today. So everyone who was registered for today's webinar will receive a follow-up email with the recording, and then anyone who's on the webinar right now can download a PDF copy of today's slides. And if you have any trouble downloading the slides, or if you don't receive the recording within a few hours, it should come within an hour of the webinar, please feel free to reach out to AHA. You should have the contact information in your registration confirmation email, and I'll add it to the chat box in just a moment. Okay, so one more question, a couple more for you, Jeannie. Is there a list of these medications, both trade name and generic name, and the classifications? And I believe that will be added to the coding instructions, but can you confirm that?
That's correct. There will be a table added to the appendix section of the coding instructions that list all the medications and the classes. Yes.
Great, thank you. Okay, so for a patient on an anticoagulation medication, will they be excluded from the dual antiplatelet therapy measure? Jeannie, we can get back to that question offline if you'd prefer.
Yeah, I'll have to check
Okay.
that measure description. I don't have it memorized by heart, but I'll take a peek, and if I get to it before the conclusion, I'll let you know.
Thank you, and we'll be sure to get back to you on that question for the submitter. Okay. Liz, I believe those are all of the questions. Can you confirm that there aren't any more that have come in? Okay, I think those are all the questions that we've received. So I just want to take the last few minutes to share the link to all of our Target Type 2 Diabetes Honor Roll resources. Again, this is the existing award program for our Get With the Guidelines stroke and heart failure hospitals, but they are available here if you're interested to see what that looks like in those two modules, and also a link to our No Diabetes by Heart initiative website, where you can find many professional and consumer resources, recorded webinars, podcasts, guidelines, and other and a newsletter sign up as well. I'd like to thank Liz Olson and Jeannie Rash for presenting today, and to thank all of you for your participation in today's event. Just a reminder that after today's webinar, you will receive a follow-up email with a survey on the presentation, and also a link to view the recording. On behalf of the American Heart Association and our presenters, thank you for joining, and have a great day. This concludes today's presentation.